Hello and welcome back. This is Dr. Munjal Thakar from Similia, the Classical Homeopathy Clinic. We operate in Ahmedabad and in Mumbai. We continue with our series on difficulties in case taking. And this time we talk of difficult cases, difficult patients, patients who don't talk spontaneously, what a homeopath really looks for. In a situation like this, most homeopaths, including myself, would have either given up the case, we would make up a prescription that would be very, very far from accurate, or maybe even people would have practiced multiple remedies and in a way not really dealt with the case with optimal efficiency. And the blame would squarely be put on the patient who really doesn't give the history. Now, this is where internally, faced with a situation like this, the homeopath would become frustrated, impatient, discouraged, or resigned. In each of these scenarios, the internal emotion that you as a homeopath would experience becomes a block to receive whatever scanty information the patient is giving you. Let me elaborate on this. Most of us are trained to look for a particular kind of information from the patients, which will enable to give us the best prescription. And this is a situation where we don't get that particular optimal so-called information. And when we are faced with this situation, our emotional reaction blocks us from thinking differently in that situation, in that case, and even more, the emotional reaction blocks us from whatever information the patient is supplying to us, and it blocks our mind from seeing a lot of sense in that scanty information. So one will need to look into this, into your own self, into your own emotional reaction. Is it becoming a stumbling block of receiving the information that the patient is giving? Are you locked in a box of getting a particular kind of information from which only you will be able to make a good prescription? That's the challenge. The way to get over this is to silence the emotional disturbance, is to get over it by purely witnessing the emotional disturbance and let it go, and to be completely open to whatever little or whatever different kind of information the patient is giving to us. And with this equanimity, one will definitely be able to see some pattern in the so-called little information the patient is giving. So keep looking into yourself. I'm sure there is a lot more to receive outside the box in which we are. So do subscribe to our channel, do like the videos, and do share it with your colleagues.